Okay, for my medical scenario video, I picked if I was a nurse at a rhinoplasty recovery center, and my scenario was a female patient came in for a rhinoplasty post-op checkup 3 weeks prior to this appointment. And when the patient first came in, as a nurse, I would be prepping the patient for a post-op review, and I would first check her vitals and listen to her breathing. I would attempt to do this with a stethoscope, and I would put the stethoscope superior to the chest cavity and keep it there for like 3 deep breaths, and I would just be looking for like if the right lung and the left lung were like working, and if I could hear it evenly, and just checking her breathing to make sure like she can still breathe after and she was healing. Her healing was normal after her surgery. After that, I would move it medial and lateral on the frontal side of her body, and then I would move to the dorsal side and do the same thing. After that, I would kind of like check on her and see if she had any weird symptoms in her pharynx, larynx, lungs, or trachea, just to make sure those areas weren't affected by the surgery. And then after all those questions were answered, I would document everything in the patient's file and keep good notes. So when the surgeon came in, or the doctor, the plastic surgeon, he could then look at my notes and consult further with the patient and make sure all of her healing was normal, and we wouldn't want anything to be abnormal in her pharynx, larynx, or trachea or anything like that due to like maybe her airways aren't clear because she like had like scar tissue or anything from the surgery, and we just want to make sure all those things are where we would want them to be post-op. And that's my medical scenario.